Excellent. So delighted to say that Top Doctors UK this morning are now joined by extremely experienced orthopedic surgeon, Professor Mohamed Imam, and he's going to talk about AI, machine learning, in terms of diagnosing orthopedic conditions, such as fractures and such. So, Professor Imam, if you would like to maybe provide the listeners or viewers at your Top Doctors profile some background information, maybe about your career.
Thank you very much. So I am a trauma and upper limb surgeon with special interest in complex trauma, upper limb pathologies ranging from a keyhole replacement, fracture fixation, and revision procedures as well. On the other side, I'm a professor of digital health, where I'm heavily involved in research and training the future generation of doctors. I'm passionate about all aspects of my career, and that's why I was awarded multiple distinctive awards. I'm fellowship trained in orthopedics and trauma surgery. And I've done multiple fellowships in the UK and overseas, including Zurich and the US. And that enabled me to offer evidence-based services and surgical and non-surgical treatments for all my patients.
Fantastic, Professor Imam. A really extensive background and knowledge now in the field of trauma surgery, orthopedic surgery, upper limb surgery, as you say. So, yes, it's going to be very interesting to get your insights into the role of AI and how can AI and machine technological learning improve the accuracy of diagnosing orthopedic conditions such as fractures or even ligament injuries or arthritis?
Excellent question. So actually now we are at crossroads where historic surgery, especially in orthopedics, was mainly hands-on, human experience, surgical and non-surgical approaches, which was hugely led by the clinicians. But now I think we are at we need to have an intersection between human intuition and digital tools, which offers us huge advantages and, more importantly, offers our patients more precise, bespoke, personalized treatments to their problems. So AI is already optimizing the way we diagnose musculoskeletal conditions. Machine learning algorithms, and we've done a few, particularly those trained on large data sets of radiographic images, can detect fractures, ligament tears, and even early signs of arthritis with high precision. We had a grant from Ethicos, where we actually are developing in the Smart Health Center in East London, where I serve as the medical director, an application that can help clinicians predict the risk of progression of arthritis in patients with fractures. Moreover, deep learning models such as convolutional neural networks, or also known as CNNs, can now analyze X-rays, MRIs, CT scan to identify patterns that might be missed by the human eye. Also, AI-powered decision support systems can assist radiologists and orthopedic surgeons in reducing diagnostic errors and improve efficiency in high-volume clinical settings. So that will improve both efficiency and productivity while maintaining patient safety and offering our patients a bespoke treatments to their problems.
Fantastic, Professor Imam. Thank you for that insight. Very interesting to see the future of AI and the role it plays in diagnosing these conditions. So thank you. And then
I
if you
think
want to,
actually this is also a myth, because it's not the future anymore. We live in a
Yeah.
digital era now, because I use a lot of tools that is automated and driven by AI in my practice, and that has enhanced my practice significantly. And we can detect and improve the patient's journey in multiple aspects.
Absolutely. It's so true. It is actually the present moment. And so we're actually really seeing the power of it. So that's absolutely very interesting. And then what role then does AI play in enhancing the precision of preoperative planning and maybe surgical navigation in conditions like arthritis?
Well, that's actually another excellent question. I believe AI is a game changer in preoperative planning and intraoperative guidance, because with AI-powered software, we can generate patient-specific 3D models from CT scans and MRI scans, allowing for precise surgical simulations. We all hear about robotic surgery, and we use it now more and more. Augmented reality shoulder replacements is the main standard in my care since starting doing them for a few years now. And that simply means I arrange for a CT scan for the patient, upload and then have the ideal plan for what shoulder replacement I'm going to use, the alignment, the sizes, to ensure the patient will have the maximum allowed range of motion. And then intraoperatively, this planning is registered on the patient anatomy, and using AI and these tools, I can make sure with an accuracy of 1 degree and 1 millimeter to undertake my planning. And hypothetically, and we can see that this should enable us to achieve better outcomes for these patients, and can, which is too early to decide, improved longevity of the implants there. Robotic-assisted surgery, which integrates AI algorithms, enhance accuracy in procedures like hip and knee replacements. And now we're working on enhancing complex fracture fixations, because these systems will help in optimal implant positioning, reducing surgical time, and improving functional outcomes. Moreover, AI-driven augmented reality tools now, which we are enhancing the current tools we have. We can overlay critical anatomical structures during surgery, assisting in real-time navigation. So it's like in certain surgical dissection, it's like in putting a large bulky mirror on a wall where you have to do multiple drills. You can eyeball or guesstimate where all the cables and water pipes are going to be. But if you have the ability to actually see behind the wall, this will reduce the risk of error significantly.
Well, very interesting, actually, to that insight, and it makes your job so much easier, and also the patients can feel more reassured as well. Oh, fantastic. So then, question three, Professor Imam, can machine intelligence and AI actually predict the patient outcomes after orthopedic surgery?
Oh, absolutely. As I mentioned earlier, we are actually doing a lot of predictive analytics now, and predictive analytics powered by AI can process vast amount of patient data, including demographics, comorbidities, imaging findings, and previous surgical outcomes, based on thousands of inputs we had from thousands of patients that we've done before, to forecast post-operative recovery trajectories. So machine learning models can help identify patients at risk of complications like infections, implant failures, delayed healing, allowing for an early intervention, possibly can lead to surgeons using extra layers of protections and precautions when they are seeing these patients. And using AI-based risk stratification tools can also personalize rehabilitation strategies to ensure optimal functional recovery post-surgery. And all these, there are a lot of predictive models, and we have done few, and developing platforms for younger surgeons to predict which patients are going to do well and which patients might struggle, and who to advise more that there is an increased risk of complications, and who we need to do extra steps to ensure we avoid that risk and mitigate the risk of complications. So this is one of the most commonly used tools nowadays in machine learning, specifically using supervised or unsupervised learning tools based on our experience, can lead to train a machine model to predict which patients are going to do better, who we need to be extra cautious, and who need to advise and counsel more about risks, and what sort of steps are needed to prevent that risk.
Fantastic, Professor Imam. And it's very interesting then to even see before surgery, after surgery, what patients will benefit more, what patients might be at risk of certain complications. And then it's kind of linking to the next question which is how can AI, how is it used in the development of, let's say, personalized treatment plans for patients after surgery?
Yes. So, we in medicine for decades, or actually for hundreds of years, we have been following the approach of one pill fits all, which actually not true. You wear a different shoe size than mine. We might be twins and we still have different shoe sizes. So AI-driven rehabilitation platforms are making recovery more personalized and efficient. Wearable sensors, motion tracking devices integrated with AI can monitor a patient movement pattern, providing real-time feedback and suggesting modifications to their rehab exercises. And we've published in this as well, because AI can enable remote physiotherapy programs and can ensure equality for our patients, because as we know, there is health inequality all over the world and actually in the same countries. So enabling remote physiotherapy program or machine learning algorithms analyze patient progress and adapt rehabilitation protocols accordingly can make a huge difference to our patients. Also, virtual rehabilitation powered by AI and gamification techniques is being used to enhance patient engagement, compliance, ultimately leading to better functional outcomes. And also there are huge advances in symbiotic prosthesis for amputees. We're now using AI models. We are seeing an important subset of our patients leading a semi-normal life with functions that wasn't even possible 20 years ago.
Wow, it's such a magnificent change in such a short period of time. You say 20 years, it's a huge change and development, which is fantastic, Professor Imam. And then I suppose, how might machine learning tools assist in identifying patterns of injury? And how does it aid in trauma prevention for some patients?
So actually, we can identify patterns of injuries, aiding in trauma prevention and streamlining emergency orthopedic care easily with AI now. It's still a difficult task, but AI is increasingly being used in injury pattern recognition and prevention. Machine learning models can analyze large data sets from trauma registries to identify trends in injury mechanisms, whether from road traffic accidents, sports injuries, or even falls at home. This will allow healthcare providers to develop targeted injury prevention strategies. And we know now that preventive measures can save the economy huge amount of money, especially in countries where there is a national health service. And this will take us to a debatable, very important topic, which is crude cost versus cost effectiveness. Because we can do something now that is 5 times more expensive to our patient, but that will save that patient by including the time spent recovering, rehab, hospital stay, hospital staff fees, etc. Huge amount of money. So that's what we call cost effectiveness compared to crude cost. So AI also plays a role in streamlining emergency orthopedic care par triage trauma patients based on injury severity, prioritize resources, assisting in early diagnosis through AI-powered imaging analysis in emergency departments, mitigate the risk of missed fractures, identify which patient should see a specialist now compared to others who can wait longer to see a specialist in secondary care.
Fantastic, Professor Imam. Delightful to get your insights into this. It's a like you say. I think it's the great takeaway is to say that it's actually happening now. So we're actually in the moment, really taking advantage of the AI developments available now. And how do you see, I suppose, the next 5 to 10 years in terms of AI in orthopedic surgery?
Yeah, I think actually 5 and 10 years in AI times is huge amount of time. Like if we look at history of humankind, we spent millions in the hunter-gatherer area, and the more sophisticated the tools we have, the lesser the time spent in each era. And that's why we've seen huge advances in AI. So AI as a concept was popularized in the 50s, but started to be mainstream in the 90s. And with the introduction of large language models, the advances are taking weeks, sometimes days, and it is huge. It is with a huge pace, and it affects all aspects of medical care. Can affect admin times, can affect dictation, can affect triage, can affect surgical and execution planning, and every rehab, as rightly mentioned by you. And so the advances is going to be huge. So I firmly believe it is an incredible tool that, when used ethically and effectively, can enhance patient care, improve the surgical outcomes of our patients, and make healthcare more personalized and, more importantly, efficient.
Absolutely. Oh, well, Professor Mohamed Imam, thank you so much for your insights. And hopefully, people can really benefit from this, hearing your insights into this. And if they would like to actually find out more information about how AI can help them with arthritis or any trauma, upper limb, orthopedic injuries or worries, they can check out your profile at topdoctors.co.uk, Professor Mohamed Imam. And Professor Imam, thank you so much for your time this morning. It's been a pleasure.
Thank you very much for having me.